Today, let's talk about when suture care is appropriate for wound management and why it's just as important to know your professional boundaries when it comes to performing or managing sutures. Sutures, also known as stitches, are used when wound requires precise approximation of tissue to promote optimal healing, reduce infection risk, minimize scarring, and restore function. Generally, sutures are indicated for wounds that are deep, gaping, actively bleeding, or located in areas where the skin is under tension, such as the joints of the hands, the elbow, or your knees. However, placing sutures is not simply a matter of clinical judgment. It must be performed by someone who is properly trained, competent, and legally authorized under their professional license. Even with training, professionals must operate within the scope of their State Practice Act and the rules governing their specific profession. For example, although I have been trained to perform wound closure from my medical background and experience in another healthcare profession, but as presently as a doctor of physical therapy practicing or with specialty in wound management, I am not legally allowed to place sutures. However, I am permitted to perform suture removal when they are due, as this falls within the allowable scope. This distinction is crucial. Even if you are fully capable from skill perspective, placing a suture without legal authority could be considered practicing outside your scope, which can lead to legal and professional consequences. Therefore, it is always essential to know your professional competencies, confirm with your license permits, and check your State Practice Act and any relevant regulatory guidelines before performing suture-related procedures. And this video is inspired of my recent encounter with people placing sutures, which I don't believe that is allowed by their State Practice Act in accordance to their specific professions. So be mindful about the legal implication of what we do. Thank you so much, and I hope you learned something today. Have a great day. With that said, it's important also to look toward the future. Some states have already passed legislation allowing doctors of physical therapy to penetrate intact tissue, such as with dry needling procedures. This modernization of the Practice Act reflects broader trend to expanding the professional scope as physical therapy continues to evolve. It raises an interesting question. Could future updates eventually allow physical therapists with proper training and within their licensure to perform simple wound suturing when clinically indicated? While we cannot predict exactly how the Practice Act will change, one thing is clear. The physical therapy profession is actively evolving, pushing boundaries with a strong focus on competency, safety, and patient-centered care. For now, we must stay informed, practice within our current scope, and remain open to what the future may bring. Have a great day.